These two right here, the outside one is the external carotid artery. The inside one is the internal carotid artery. This is the CV. It's not supposed to work like this. The whole thing right here is the internal jugular vein. The external jugular vein runs parallel. So this looks deceiving. You would think one is the external, the other one is the internal, but that's not the case. This is the internal jugular vein. The external jugular vein sits right here. Okay? The internal jugular and the subclavian vein becomes the brachiocephalic vein. This one's coming from the left, so it's the left brachiocephalic vein. This is the right brachiocephalic vein. Kind of like in the freeway. There's the San Diego portion of the freeway. There's the Santa Monica portion. There's a, I don't know, the 101 portion, whatever, of the freeway. So this is the same vein, but in different regions it's called different names. So right here, you call it the subclavian vein. In the axillary region, you call it the axillary vein. In the brachium, you call it the brachial vein. Same vein, different regions. Kind of like the freeway. The San Diego freeway, the Santa Monica freeway. The same freeway, but just different parts. You call it different things. This is the left subclavian, axillary vein, brachial vein. So far, so good? The two brachial veins become the superior vena cava, which it dumps into the right atrium. Subclavian vein, subclavian artery, axillary artery, brachial artery. Thumb side, radius or ulna?
Radius.
So this is the radius vein and artery. So therefore this side must be the ulnar artery and vein. The one in the middle would be the median artery. The one that you can see is the superficial palmar arch. The one underneath it, the lighter blue one, is the deep palmar arch. Deep palmar arch, superficial arch. On this side, it's concurrent with this one. There's only one on this side. This one's going to the scapula, subscapular artery. These two on either side is along the lateral thoracic artery. The lateral thoracic artery. So subscapular, the lateral thoracic artery. This one wraps around the humerus. It's the humeral circumflex artery. Pulmonary artery, aortic arch, ascending arch, and then descending goes underneath. These two right here, pulmonary veins. They're red, but they're still veins because it's going to this chamber, which is the left atrium. Okay? Inferior vena cava. This one is the abdominal aorta. Once it bypasses this muscle, it's called the diaphragm. And, superior to the diaphragm, you call it the thoracic aorta or the descending aorta. Below it, you call it the abdominal aorta. So 1, 2, 3 unpaired arteries. Celiac trunk, superior mesenteric artery, inferior mesenteric artery. The celiac trunk actually has 3 branches. This one's going to the stomach, so it's the gastric, left gastric artery. This one's going to spleen, splenic artery. This one right here going to the liver is the hepatic artery. Okay, so celiac trunk is divided into 3. These 2 organs right here, kidney, renal artery, renal vein. Okay. These 2 veins are coming from the liver, hepatic vein. This vein is actually coming from the intestines, hepatic portal vein. It's just a little bit off in coloring. The blue color is the hepatic vein. The purplish color is the hepatic portal vein. This one's coming from the stomach, so it's the gastric vein. This one's coming from the spleen, splenic vein. Okay. What runs parallel with the superior mesenteric artery is the inferior mesenteric vein, because the superior mesenteric vein is all the way up here. Does everybody see that? The two parallels are these two: the inferior mesenteric vein and the superior mesenteric artery. This is the superior mesenteric vein. Make sense, everyone? These two, remember, the gonads in the female are in the pelvic region. The male's reproductive system also starts in the pelvic system, but they descend later. So therefore, these two are the gonads, gonadal arteries. Okay, gonadal arteries. Then it branches off into two. This part right here is called a common iliac. The common iliac divides into two: external iliac and internal iliac. I believe this is the sacromedian artery. Sacromedian artery. It runs parallel. The internal iliac artery, internal iliac vein. External iliac vein, external iliac artery. Once it passes out the obturator foramen, it changes names as the femoral arteries and veins. As in the arm, the same thing as in the legs, as well as in the abdomen. Make sense? Okay. The femoral circumflex arteries and veins are these. I believe this is the anterior and that's the posterior, but all you need to really know is the circumflex. The deep femoral vein is this one, because it goes deep inside. Okay, that's the femoral arteries and veins. The geniculate arteries and veins occur in the back, because this is a side view. So this is the popliteal artery. The geniculate artery sits on top. Okay, the popliteal sits on the back. The geniculate sits on top. What you once again you look for is whichever ones that goes into the arches. This one is the anterior tibial artery, and that's the posterior tibial artery. Vein. This is the anterior tibial artery. This is the posterior tibial artery. So once again, you're looking for the ones that goes into the branch. Tibial, anterior, posterior. The one in the middle is the fibular artery. Veins. This one right here is the great saphenous vein. There's no great saphenous artery. There's only a great saphenous vein. Another one right here is the basilic vein. There's a basilar artery in the brain, but it's a basilic vein in the arm. And this one right here is called a cephalic. Cephalic. That's everyone? Mm-hmm.